So, for the second part of this week's chapter, we're going to look a little bit more about adolescent development, spend a bit of time talking about the development of adolescent sexuality during the course of this time period, and then look at some of the many developmental challenges that teenagers face in our society on a day to day basis. Spirituality is one other area of development that didn't get covered in the previous section, but this is a particularly sensitive stage of life for a spiritual exploration. And like other areas of life, I think the less you question these things directly and the more you can go about and a roundabout way, implicit way of exploring the adolescent's spirituality, you may get a better sense of what exactly is going on there for the teen. But they do have this greater capacity for abstract thinking at this stage in life, and so it's really a time when I think a lot of exploration about these issues may be going on. For myself, I know that this occurred much later in my adolescent years as well, for one thing, I had an older brother who was ordained into the priesthood and was attending a seminary all the years through my high school years, and his ordination coincided with my high school graduation the same year, and so my own freedom, let's say, to explore these issues really didn't hit me until I left for college and moved out of the home and things like that, and there was quite a period of time during my early adult years as well of doing a lot of reading and things like that about spirituality. And I believe this is much the same for those of you listening to me here. While sometimes our family's involvement in religion has been a source of some discomfort and unhappiness for us, at other times it can still be a source of resilience for a lot of teenagers. Now, once again, there's a difference between church attendance and say religiosity and spirituality, and the distinction between the two of them is defined in the textbook. But it says that 40% of teenagers say they attend church regularly and pray daily, or are involved in a church youth group, any and or all of those things. But more than twice of that number say that they believe in God. So in many respects, the most important influence on the religious and spiritual life of the adolescent is the parent. That would certainly be no surprise. Now jump into another topic, adolescent sexuality, and the section starts out with a discussion about how the sociocultural environment has a lot to do with how sexual feelings get expressed. And as an example here is when and how to engage in sexual activity may be closely linked to what the adolescent perceives to be the activity of their peers. Other studies have, for instance, also said that, tying back into the question of religiosity and spirituality, that children, young people who are engaged in church activities, who attend church with their parents and those kinds of things, are more apt to delay for sexual involvement and have fewer sexual partners. Certainly, in more, again, the term primitive comes to my mind, but in the more underdeveloped, let's say economically underdeveloped societies, sexuality is something that emerges and is actually facilitated at a much younger age than in most Western societies. And indeed, in many Western societies, sexuality is treated very differently from one culture to another. Sweden, for instance, integrates sex education into its educational program formally from kindergarten forward. And the answer, interestingly, as we'll touch on later, the incidence of adolescent pregnancy, although they view sexuality as a much more natural kind of development, like all other things in adolescence, as opposed to the United States, which kind of gives us its own category. They have a much lower teen pregnancy rate in such cultures. And in fact, how we treat it differently is suggested here by the fact that, this text spends many pages exploring the issue of sexuality, and there's a lot of slides devoted to it here, whereas the other topics kind of get one or two slides. So it tells you that, we have it's interesting in our culture, we have very conflicted feelings about sexuality, and it comes out sometimes, I think, in how we deal with this with our teenagers. Masturbation is one of those topics that nobody wants to talk about. Boys oftentimes are embarrassed to acknowledge it, although again, I believe that is beginning to change some at least. Here, this slide says that about three-quarters of boys and almost half of the girls reported, quote, reported having ever masturbated. A psychologist I once worked with at the children's home in Orlando years ago, he was interviewing one boy who denied, a 15, 16-year-old boy who had denied that he ever masturbated. And the psychologist kind of chuckled and said, let's face it, everybody masturbates. And so these numbers probably are inaccurate, but in any event, the discussion about that is that there's just a lot of negative associations still for some teenagers about this. In some churches and religions, it's a sin, and so that certainly puts a lot of other layers of problems associated with the behavior that otherwise might cause some social issues. Talk a little bit about how our culture responds to things. Bill Clinton's Surgeon General in 1994 was fired, and the press reported that what she said is we need to teach our kids to masturbate, and well, that would have been put pretty poorly if that indeed that's the way she said it. And in fact, she had been getting into some trouble with the administration because she was a little too outspoken and in some areas about drug use and things like this. But if you look this up, what it says is she was asked by a psychologist who was attending a conference on AIDS, which of course was still a relatively new discussion in our society, even in the 90s, and so the psychologist was attending a conference where she was talking and asked her about the prospects for a more explicit discussion and promotion of masturbation as a means to limit the spread of the virus, the AIDS virus. And Dr. Elders began by describing herself as a very strong advocate of teaching sex education in schools, quote, at a very early age. And and it's the quotation, as per your specific question in regard to masturbation, I think this is something that is a part of human sexuality, and it's a part of something that perhaps should be taught. But we've not even taught our children the very basics. That's what she said. It's very different from saying we should teach our kids to masturbate. And anyway, anybody that understands the issue understands that what she said, there's probably some truth to this. We need to tell kids it's okay. Not quite half of high school students reported having had sexual intercourse, and the average age in the United States is really, I think, quite close to other economically advanced nations, is 18 years of age for first sexual intercourse. Early engagement in intercourse does have negative consequences, things such as substance abuse, school issues, conflict with parents. Teen pregnancy also at an early age can have some kind of rather disastrous implications, I believe. One of the issues we have is the teens in the United States make less use of contraception than teens in European countries do, which is one of the things that helps to contribute to our having the highest teen pregnancy rate compared to other Western nations. Sometimes with teenagers, one of the things that is true about this is that intercourse occurs sometimes when they've been partying, when they've been drinking, or using some sort of substances, and the likelihood that they're going to use like a condom in such circumstances becomes much less than it would be if it was something that was kind of planned or something along those lines. As far as sexual orientation is concerned, the description of sexual orientation is the erotic, romantic, and affectionate attraction to people of the same sex, the opposite sex, or both sexes. This is the LGB parts of the LGBT population. There are some thinkers who believe that really the LGBT, the T part of that, kind of confuses things more because the issues are really pretty different, sexual orientation versus gender identity, and that it might be clearer to those who have trouble understanding any of those concepts. It might be clearer if we separate those two concepts, although the members of those communities often experience much the same kind of issues, socially speaking, with the rest of the public, whatever. It might be beneficial to separate them out. But kids are coming out at earlier ages than in previous eras. There was a time when social work textbooks told us to counsel against kids coming out of the closet during their high school years. The reason being, at the time, the thinking was, well, they're still dependent upon their parents. There isn't a lot of people in the peer population who would be supportive of them, and there's not as many places for them to go. We were instructed at that time to encourage kids to just kind of keep it to themselves until they were functioning more independently. Now, times have changed. Although the peer group still has much of the peer group still has issues, nonetheless, there's a larger population. The younger generation is becoming more accepting of different sexual orientations, and so perhaps that's changing. My advice to you would be, if you're working with a teen who's contemplating this, is to spend some time and assess the support system and the environment around that teen, and make sure that he or she has the necessary protective factors, let's say, in place that will enable them to move through that coming out process positively. There are a lot of protective factors that promote resilience in sexual minority youth, and so here are some of the things you might want to look at when you do engage in an assessment such as that with a young person. As mentioned earlier, the United States has, if not the highest, one of the highest adolescent teen pregnancy rates in the world. It is the birth rate, which is, I guess, different from the pregnancy rate, is almost 30 per 1,000 in the 15 to 19-year-old age group. So the teen pregnancy rate has declined since the early 1990s, but it's still higher than most of the rest of the economically advantaged world. Variations exist concerning race and ethnicity, as well as by region of the country. Actually, I think it's the southeast United States that has the higher teen pregnancy rate. It's interesting if you go to this website here, and I don't know if the hyperlink works off of your page or not in front of you, but if not, write this down, because this is the Health and Human Services Office of Adolescent Health page, and there's just a ton of information there. And not only is it presented on a national level, but there's breakdowns for every state in the union in each of a variety of different areas, and adolescent pregnancy and childbirth is only one of them. Goes into things including like substance abuse and many other areas. So it's really a great website to check out if you're going to be researching anything about adolescents or working with this population. Just of interest, Alaska was ranked 11 out of 51, that includes the District of Columbia, on teen birth rates among females 15 to 19 in the year 2015. One being the highest rate, and so we were near the top, but not at the top. So that's something that is significant, I think, and tells you that we have a lot of work to do in Alaska to help resolve that issue. There are all sorts of risk factors involved with adolescent pregnancy, and I would say both for the adolescent parent, the teen parents, and the child. See, this is one of the things that guys do, when we talk about teen mothers, is we forget there's a teen father involved too. So forgive me for that. But for both teen parents and for their baby, the fact is the teen mothers are usually the ones that are left with the responsibility for that child and her family. And sadly, teen fathers are not as involved with their children as they should be in most cases. But teenagers are likely to delay prenatal care, partly because they don't want to tell anybody about their pregnancy, I think. They have higher rates of miscarriage and all sorts of illnesses associated with the pregnancy. And there's a lot of social factors that are involved also in that are really very negative for them. And studies have shown that by the age of, I think, 30, teen parents' income is like much, much lower than teens who have gotten through the adolescent years without pregnancy. So it does have long-term impacts as well. As far as STDs or STIs, as it's referred to here, people between the ages of 15 and 24 comprise almost half of the 20 million new cases of STIs each year in the United States. 40% of sexually active teenage girls have some form of sexually transmitted infection that can cause infertility or even death. As far as HIV and AIDS is concerned, HIV diagnosis increased in the 15 to 24 year age groups. In the study of between period 2006 and 2009, almost 80% of the HIV positive adolescents were boys, and among those, 90% of those infections resulted from male-to-male sexual contact. So this is another reason why there's some benefit to getting to a point where we can make it easier for kids to, I believe, to discuss their sexuality, and if young people are engaged in, boys here in particular, engaged in same-sex sexual relationships, so we have a chance to intervene and educate them as much as possible. The Center for Disease Control says that half of all undiagnosed HIV infections are in the 13 to 24 year age group. Half of them are essentially adolescents and young adults, undiagnosed. Moving on from adolescent sexuality, we look at some challenges to adolescent development, and substance use and abuse comes up, of course. There's all sorts of experimenting that goes on during this age with all sorts of substances. With Alaska, I don't know, it remains to be seen as to whether or not the legalization of recreational marijuana in Alaska affects the adolescent rate of use or not. Kids certainly have been experimenting with marijuana for years, long before it was legal, and it's still illegal for youth, of course, so perhaps there won't be any change. My own gut tells me that any time a society loosens up its expectations for adults in a certain area, teens are going to follow. But in any event, there's all sorts of experimentation that's going on, and some of that has to do with the peer group, and some of it has to do with stress in kids' lives, and just wanting to feel more grown up. But the rate of illicit drug use among American teenagers in the 12 to 17 age range has remained fairly constant at around 10% since 2002. To me, this seems low, but these are the figures that we're given here. So it's just not intuitively, it doesn't make sense to me. Native American adolescents. Now, here are some contradictions in what I'm reading into these figures. Native American adolescents, almost half, have the highest prevalence of use of alcohol and other drugs in the past year out of all United States youths aged 12 to 17. So we, in Alaska, our youth have the highest prevalence of past year alcohol or other drug use, followed by white adolescents and Hispanic adolescents. Native American adolescents, I should say. Okay, that's not necessarily specifically Alaska Native, but according to that website that I gave you a couple of slides back, Alaskan youth usage rates are similar to the national average for cigarette, alcohol, marijuana, and other drugs. So, I don't know. I suppose the difference between 47.5% and 39.2% and 36.7% isn't that great that maybe it wouldn't show up. But in any event, the HHS website kind of suggests that maybe Alaska youth usage is more similar to the national average, although this then would imply that the heaviest use of alcohol and drugs then is among lower 48 native tribes on the reservations and things. Perhaps that's true. I just don't know. Take this for what it's worth. It's worth more study if you're interested in it. And again, that website will tell you state by state what the usage rates are. This is an issue aside from all the obvious concerns we might have about our teenagers getting drunk and high or stoned, however you want to look at it. Again, because of the developing brain, these substances alter neurotransmitters, and so the brain is still developing, like we talked about earlier, into the mid-20s perhaps, and so regular use of alcohol and drugs will impinge upon that development and could have long-lasting effects on developing brain and nervous systems. And early substance use increases the risk for later addiction and depression. When I the presentation that I gave you a few weeks back on the effects of domestic violence on young children in the home was a part of a presentation, if I remember correctly, by Linda Chamberlain, a longer presentation on the developing adolescent brain. And she said in that presentation, she talked about the fact that kids that really start using early in their adolescence are the ones that are at greatest risk for addiction. And she told us as parents, that you tell parents that every 6 months you get by without your kids really being heavily involved in drugs and alcohol, count that as a win, because it's that much closer to getting them to adulthood where they're going to be free from addictions and depression and things like this. So that's something to keep in mind. This is a very sensitive period of time developmentally for kids, and it's another reason why we want to encourage kids to avoid use of those substances when we can. Anytime a child breaks the law, this is an act referred to as juvenile delinquency in our society. So that when a child is found guilty of committing a crime that by adult standards would result in some sort of civil penalty, that's a juvenile delinquent act. Now, there's also another type of errant behavior on the part of adolescents behaviors that would not be crimes if they were adults, but are still considered to be problematic for society and that justify the intervention of society into the lives of kids, and these are called status offenses. And they include such things as running away, skipping school, violating curfew, possessing tobacco or alcohol, which I really never heard of being referred to as a status offense before, but times change. Also, in many states there is a legal status referred to as a child in need of supervision or an ungovernable child, and that basically says that they're beyond the control of their parents. That's also another status offense that you may run into depending upon where you practice. And there's a lot of controversy around status offenses and how they're used by the juvenile system, because there really isn't an answer for providing, let's say, consequence. So you want to look at providing services more than consequences, I believe. You can't be locked up even if you're a kid. Theoretically, at least, you can't be locked up if you don't break the law. And status offenses are not law violations. And courts have been known to incarcerate status offenders when they repeat those behaviors, and it becomes a big issue. And not to mention the fact that they're being put in a population where kids have engaged in a lot more serious behavior. So anyway, this is something for those of you that are going to be working with juveniles that you'll be exposed to. Just like anywhere else in the criminal justice system, African American youth referred to the court for delinquency offenses are more likely to be there than white youth. This says 150% more often. And once adjudicated, black youth are more likely to be sent to residential placement, something like 23% higher, at a 23% higher rate than white youth. So this, like we talked about with foster care a week or two back, disproportionality also exists in the juvenile justice system as well. Other kinds of issues that kids are faced with during adolescence include bullying, and this has been touched on earlier. Unwanted aggressive behavior among school-age children that involves real or perceived power balances. And here actually I seem to remember that previously there were two forms of bullying. We have three here: verbal, social, relational, and physical. The school to prison pipeline, where basically many schools have practices that push the troubled students out of the system, out of classes, out of attendance at school by suspending them or expelling them altogether. And into the juvenile and criminal justice systems in many cases. Again, students with color, students with disabilities, students with non-heterosexual orientations are overrepresented in this group, and that's an indication of the fact that there are other factors to play aside from strictly behavior. The survey that of Texas schools, I believe it was, as mentioned in the text, indicated that something like 3% of these suspensions are required by state or federal regulations or laws. So that basically says that almost all of these things are at the discretion of school administration and local school boards and things like this. And so these are things that I think it's an area perhaps for advocacy on workers' behalf, or rather on clients' behalf by workers. African American students, again, 3 times more likely to be suspended and 3.5 times more likely to be expelled than white students, with Latinos 1.5 times more likely to be suspended and 3.5 times more expelled. And of course, the issue here is that once kids are expelled, the likelihood that they're going to be able to come back and finish their schooling and get on with their lives, it becomes much more remote. Community violence is mentioned off and on as a risk factor, and here is a challenge to development for this age group. That kids of teen years were 4.7 times more likely to be victimized by friends or acquaintances than were persons older than 35. Homicide is the second leading cause of death for juveniles between 10 and 24, and was the leading cause of death for African American youth, second for Latino, and third leading cause of death for American Indian and Alaska Native youth. Almost 83% of all youth homicides are committed with firearms. Dating violence and statutory rape. Acquaintance rape is something that, it's defined as forced, manipulated, or coerced sexual contact by someone known to the victim. It isn't always, they call it date rape sometimes, but it's not always on a date. It just has something to do with behaviors occurring between a person, generally a woman, usually, but not always, and usually an older or same-aged peer or friend. But women in the 16 to 24 year age range are the ones who are primary victims in this category. And I think I may have mentioned this earlier in the semester, but a text that I have taught my family violence class out of says that the prime venue for this to occur is at parties with friends, and particularly among young college students. Somebody goes off to get the victim a drink and drops some drugs into the drink, and the next thing they know, the victim's waking up and doesn't know what happened, has been raped. And this is sadly not uncommon. And so it's wise to counsel your young clients with this in mind. That, for one thing, don't ever let anybody else mix a drink for you. But better yet, stay away from those parties. Statutory rape, which is the sexual interaction between a young person and a much older person. But that depends from state to state. I think Alaska's age of consent is 16. Some states have that set at 18. Others have it set, I believe, down to 14, I believe, in a couple of the southern states. And what this means basically is that if a child at that age engages in a sexual interaction with an older person, and there's supposed to be a difference in age in most states, so that again in Alaska, I think that the difference in age is 4 years difference in age. It was raised a few years ago from 2 or 3 years of age difference in age to 4 or 5 years difference in age. I'm sorry, I'm vague on the specific statute now that I'm retired, but in any event, the difference in age also has something to play there. Other states, I don't think, even have that issue, so that a young person at 13 or 14, engaging in a sexual interaction with another young person of the same age could still somehow be making a law violation. So it's something that, depending upon where you practice, you want to make sure you understand the statutes in those areas and educate your clients about that. Physical, and this isn't mentioned in the textbook here, and I just a lot of times child protection systems are criticized because they turn their backs on teenagers, and I have to say, when you're dealing with caseloads with smaller children and preschool children and those kinds of things, you you do find it's fairly easy to begin to believe that teenagers can more or less take care of themselves. And um, as a carrier, as a caseload carrier, I should say, as a worker, I used to always argue against that because I met so many vulnerable teenagers that really did need our intervention. As I went on in my career, and as I became a supervisor and I became responsible for kind of distributing an overburdened workload among too few workers, you can imagine that the concept of teenagers taking care of themselves became a little more palatable to me, whether I want to admit that or not. And so we often get criticized because we don't intervene on behalf of kids, um, teenagers, as vigorously as perhaps we ought to in systems that treat physical and sexual abuse. Now, at the same time, those children have, at least biologically and socially, have an enhanced capacity to speak up for themselves. But all those psychological pressures on victims, whether female or male victims, exist that discourage kids from speaking out. When you are working with a kid who's a runaway, though, always explore for what was going on in the home, because oftentimes the reason they've left home has to do with abuse, or physical or sexual abuse. And those kids that don't get services, that don't get taken off the streets, are often they wind up being exploited sexually, just to survive. Poverty and low educational attainment, the two connect very much. 38% of United States teens lived in low income households in 2012. That's poverty or near poverty. And that is increased since 2000. Now, the the recession had something to do with that, certainly, but a lot of the conservatives, with with the work requirements, and having reduced the welfare rolls, so to speak, through the revisions in the welfare reform during the Clinton administration. A lot of those advocates for that change will say that we've reduced poverty so much. Well, poverty hasn't really been reduced. Number of people on welfare rolls have been reduced, but that's an entirely different issue. For a teenager, being poor increases the likelihood of low academic achievement, dropouts, teen pregnancy, teen births, delinquency, unemployment, and so on. Poor health is another consequence of living in poverty as a teenager. These kids are less likely to graduate from high school, and even if they go on to get a GED, this text points out that after all is said and done, they're functioning, economically speaking, their employment and their earnings are more similar to high school dropouts than they are to high school graduates, and that's something that's significant to keep in mind. And for those kids that are going to have problems in school, it does appear as though transition into ninth grade is particularly a vulnerable time, and that's really the time when kids are moving out of middle school into senior high school. Maybe probably the first year of senior high could be if it's a junior high system, might be the last year of junior high. And here you have kids that are in middle adolescence, maybe early adolescence even, and some of them are lagging behind in terms of their cognitive and social development. And so it's going to be a tough year. Keep an eye on kids that are freshmen. Eating disorders and obesity. Weight concerns are so prevalent these days in our society that we don't really even hardly notice it with teenagers anymore. Much much more of the probably for underweight as overweight adolescents. And I like the way the text puts it: an increasing minority of adolescents in the United States is obese. Um, and these kids are going to suffer exclusion, social exclusion, and discrimination in most all areas of their life if they continue to be overweight like this. Sometimes kids, with the growth spurt, can kind of outgrow the early adolescent overweight period. Others don't, and so I think this gets back to encouraging the youth to exercise, have a healthy diet, get plenty of sleep. But body dissatisfaction is a major factor in the three eating disorders mentioned here, which I'm pretty sure you're familiar with, anorexia, bulimia, and binge eating. Binge eating is more associated with males and females, but the other two are more associated with females. And uh, when you think about the fact that as girls in particular, as they transition into adolescence and go through puberty, and their body responds to puberty with an increase in fat deposits in different parts of the body and a greater weight and everything, because of our focus upon thinness in our culture, that makes a lot of girls very, very dissatisfied with their body, and is one of the reasons why I think a lot of those kids wind up with these kinds of disorders. And I will add, by the way, should you get an adolescent or an adult, for that matter, with anorexia or bulimia, be sure that you have that client hooked up with a physician, an MD, and that you have releases so that you can speak back and forth with the MD about what's going on, because even if you're doing weigh-ins, the person may have you convinced that they're making progress when they're not, and coordination between a physician and a worker is something that's very critical in this treatment if you're doing it on an outpatient basis in particular. Um, Again, this number seems so low to me. Maybe 5% of mid to late adolescents are depressed in any given year, rising to a high of 20%, which seems more realistic to me by the end of adolescence, and it's twice as likely to happen with girls. Boys, again, we socialize our boys not to focus on their internal emotions, and so when they have all this upset inside, what happens a lot of times with boys is they act out. That could be in anger, it could be in law violations and unruly behavior and things like that. Girls are socialized to be attuned to emotions and to remain feminine, not to be aggressive and not to be too physical, and so those emotions are recognized and are internalized, and so oftentimes you'll see girls be more depressed. But understand, both boys and girls may be experiencing depression, but showing it, exhibiting it in different ways. Because of that, and for other reasons, depression in adolescence can be very hard to detect and is underdiagnosed or misdiagnosed, and sometimes it looks like normal ups and downs. But oftentimes parents aren't aware of it, and with the teenager, a lot of times depression looks like irritability. Again, I think especially with males. Not quite a third of high school students reported being so sad every day for 2 weeks that they stopped doing usual activities, and that's one of the features in the DSM-5 in terms of diagnosing depression is that loss of enjoyment for the kinds of things that one usually enjoys. Suicide is the third leading cause of death for U.S. adolescents, and again, firearms is the most prominent form of or means to a suicide. And it's also one of the most effective means as well. Interesting, suffocation to me. I had to look that up even, because it's something that's not new, but it's something that I didn't realize was all that frequent among adolescents, but where kids are tying plastic bags around their head and things like this. I don't see hanging in this, and I among the sadly, the teenagers that I have known over the years who killed themselves, hanging themselves was one of the was the method used as often as any others, and maybe suffocation includes that. I don't know. Never discount when kids talk about wanting to kill themselves. And you've heard this elsewhere. Always consider that to be a serious threat, and evaluate it more closely, or refer to someone who has the ability to do that if you can't. Boys are 4 times, they used to say 5 times more likely to kill themselves than girls, but girls were 5 times more likely to try to kill themselves. And I think this author tells us that American Indian Alaska Native youth have the highest rate of suicide-related deaths. Some years back, there was an extensive study article and study done in the Anchorage Daily News about the youth culture in rural Alaska, as I recall, and it said then that Alaska Native males had a suicide rate that was 5 times the rate of young males in the lower 48. So suicide is certainly something that is a very major concern in Alaska, and really does require your attention to get good training and know how to respond to that when faced with the possibility of that. And gay male and lesbian adolescents have a higher risk for depression and suicide than the general population as well, given the complications and the troubles that they often run into because of their sexual orientation. So, the social disadvantage and all of the negative experiences that a child experiences from infancy onward works all the way through adolescence. It increases the likelihood of risky behaviors in adolescence and even into adulthood. And, the risk factors here, we've gone through many of them just now or in previous chapters, but, all the things about abuse of drugs and teen pregnancy, unsafe sex, those school dropouts, those kinds of things. Protective factors are those kinds of factors that really help mold resilient kids. Good family relationships, a capacity to cope with adversity, social support, good services in the school and in the community. And it says that prior to adolescence, girls have a better balance of risk and protective factors, but the advantage goes to boys during adolescence, and I'm not quite sure how they measure that, but that's what they say, that girls have a tougher time getting through the teenage years. And giving adolescents a voice in society has been identified as a potential protective factor for kids. So listen and engage them in the events of the day. So implications for practice. First is meet the adolescent client where they are, physically, psychologically, socially. That's sort of a given for any client at any age. But the complication here is don't assume that you know where they are. Ask about that. And even if you knew where they were the last time you saw them, it may very well have changed, because this is remember the psychological moratorium. Kids are trying on all sorts of different identities and roles. And so from contact to contact, things can change very rapidly. So always assess for what's going on there. You should be familiar with adolescent development issues and consequences for deviating from the timelines expected by those around them. Know what your teen's level of cognition and comprehension is, because that's going to have something to do with the way you intervene with that child. A good point here is expect to spend a lot of time building rapport with kids. And when I was doing outpatient therapy with teenagers, sometimes I'd have to sit down and explain to parents, because the kids would go home and, they'd ask the kid, well, what did you talk about? Well, first of all, the kid's probably not going to tell them if they were talking about any issues, that were of concern to them that maybe they didn't want their parents to know about, but they tell them about some of the casual things we talked about. Well, we talked about baseball, whatever, and the parents come in and say, look, I'm not paying you to talk about baseball standings with them. And you have to take time to get to know kids and to help them to feel comfortable with you, and that includes spending time finding things you have in common with each other. And the more you can do that, let's say, of course, you have other things to do with your teens, but the more you can do that, the more likely it is the kid's going to be able to feel like he or she can, turn to you and to confide in you, and this is what you want. Remember, as an adult, for a lot of adolescents, you're automatically an authority figure and you're not an ally necessarily. So you got to build that rapport and help. You may wind up being one of the first adults in that teen's life in many, many years that actually listens to that kid. And keep that in mind, that you have an opportunity to really affect that child's view of the world and adults in the world by being someone who gives credibility to what they say and takes the time to sit down and listen and to respect their opinions. Look at the school and how the school is impacting your client, and be ready to advocate to change those things in the school culture or settings that are harmful to your child. Be able to link your child to resources if they have needs that you're not going to be able to service everything, obviously. And of course, as social workers, a lot of what we do is case management, and so know your community resources and remember, include that natural helping network. Look for those mentors in the community. These are people that are going to hang with this kid over time, and so that's a good resource to look for. Be a good source of information support for adolescents resolving questions about gender identity and sexual orientation. Again, you may be the first adult they've come to with those thoughts and concerns, and so you want to be well informed about them and how to handle that and respond sensitively. Provide information support for substance abuse issues, and know about the use of less frequent drugs by youth, including things like prescription medication. And in Alaska, aerosols are, in general, with young adolescents, aerosol inhalants are one of those things that younger adolescents are more apt to use because they have easier access to that than they would to alcohol and other drugs, just because of their age, if nothing else. And of course, inhalants, have a risk of being deadly. I worked with a 13-year-old boy years and years ago in a foster home who probably accidentally, perhaps not, killed himself inhaling an aerosol. It was a powder dry aerosol, and it coated his air sacs, and he suffocated. So this is something to be aware of and to intervene with. And kids in the remote communities, particularly those that are dry communities where alcohol is very hard to come by and everything, you'll see a greater incidence of inhalant abuse in the rural communities sometimes than in the other communities, but it's prevalent all over Alaska. Help develop those skills that kids need so they can be helped with their physical and mental health issues like I mentioned here, or refer to community resources if necessary, if you don't have those skills or knowledge. Know about the signs of depression and suicidality. Sometimes those unique signs and unique methods that are peculiar to Alaskan youth, and be aware of the availability of the means of suicide around your young clients. For kids, for instance, that are prone to inhalant abuse, if you got that, one of the things you're going to do is inspect under the cabinet, under the kitchen sink with parents, because there's a lot of inhalants there, and get them out of the household. If there's a suicidal youth, weapons, another thing in Alaska that a lot of homes, I think there's weapons in homes all over the United States, of course, as we know, but there may be more I think a higher rate of them in Alaska for a variety of reasons. And if you have a suicidal youth, ideally you get the weapons out of the home, but you certainly make sure that the weapons and the ammunition are stored separately and under lock and key. And again, a lot of homes keep loaded weapons by the bedside because of whatever, and that is something that you don't want to have happen with a kid that's suicidal. engage in research, policy development, advocacy on behalf of adolescents. If you're a research person as opposed to a clinical person or somebody who's out there working directly in the field with clients. And also on another macro level, work in your community to develop and sustain social and recreational programs that give young people safe places to go. Sometimes the trouble they get into has to do with the fact that there just isn't a place for them where they can be themselves and feel safe and an environment shaped for them. So that gives you some ideas about the world of the adolescent. If you have questions, please let me know about any of this material, and I hope that you find it useful, as always. So until next time, that'll be it for now.